Hello my dear doctors, now moving on to the most important topic in systemic embryology, that is head and neck embryology. And you can always expect a question from here in any exam that you attempt in India. So in systemic embryology, this head and neck embryology, we are mainly first of all going to study about the development of the pharyngeal apparatus, like pharyngeal cleft and then pharyngeal pouches and then pharyngeal arches. Now what I have observed during the live classes that most of the students, first of all, first year onwards, they don't have a clarity between like what is a cleft, what is a pouch and what is an arch. So first 5 minutes we are going to understand the terminology, and once you're perfect with the terminology, after that you have to just learn what is derived from there. So let's start from the scratch. I'm not going to take any risk over here by directly going to the derivatives and all. So let's start from the scratch and first learn what is a cleft, what is a pouch and what is an arch. To understand that, look at this diagram. You have seen this diagram like hundreds and thousands of times in your life. Now in this diagram of embryo, we know these are the upper limb buds over here and this will be the lower limb buds over here. And all these are nothing but your somites. We have learned about them in detail in general embryology, all the somites. And somewhere here will be the cardiogenic area where your heart is going to form. Even that was also asked once in the AIMS exam. So that is the cardiogenic area where heart is going to form. But right now we are concerned with these arches, So our area of discussion or our focus should be on this region here. So somewhere here the pharyngeal arches near the neck region. Now first of all, to understand the orientation here, let me do one thing. Let me take a section of this one. So once you take a section of this pharyngeal arches, the picture will be something like this. I want the view, the orientation to be very clear. Now what is the germ layer on the outer side? On the outer side, you'll be having ectoderm. And what is the germ layer on the inner side? On the inner side, you'll be actually having endoderm. So there will be ectoderm and endoderm, and in the middle, there will be mesoderm. Okay. Always what is happening here, what I have seen is that students will be seeing this diagram and they're always thinking that, the embryo in this manner only. Guys, if there are arches over this side, of course, there will be arches on the other side also. So because the arches are on both the sides over there will be on the outer side ectoderm. And then on the inner side, there will be endoderm. And then in the middle, what do you have there? You'll be having the mesoderm present. Perfect. Till here it is okay. Now make the diagram much more clear with this one. This is the place where the students are getting confused. Like, what is this diagram about then? Like, what is the view of this one? Come on. Imagine like you are an embryo and I'm also like an embryo right now. And there are like 6 arches coming from one side, 6 arches coming from the other side and meeting here. Okay, so suppose we are like an embryo here like this. So there are 6 arches coming from here, 6 arches coming from here, meeting in the middle. Now what we are going to do is, we are going to take a section and remove our own arches, and we are seeing our own arches from inside here. Wow, beautiful view. So I repeat again, our own arches, we are taking a section, we are removing them and seeing the arches from inside. So there will be ectoderm on the outer side here, and then there will be endoderm on the inner side here, and then in the middle there is a mesoderm. Exactly the same view is this one here. So these are the arches, our own arches we are seeing from inside. So what do you have on the inner side here? There will be endoderm. And what do you have on the outer side here? There will be ectoderm here, guys. And in the middle, whatever you are able to see, that yellow colored one is nothing but mesoderm. Now what is the further development? The further development is that ectoderm will actually invaginate inside, whereas endoderm will actually evaginate out. Ectoderm will invaginate, whereas endoderm will actually evaginate out. So keeping all this idea in your mind, I hope I have given like enough orientation for you to understand. Keeping all this in our mind, let's get started with writing in our notes right now, guys. And I am going to start a little bit from the earlier aspect. So imagine this black colored line here to be your ectoderm on the outer side. And imagine this red colored line to be your endoderm on the inner side. And here you'll be actually having those buccopharyngeal membrane, which is actually going to form the future mouth. So we are not going to draw the entire embryo. I'm just going to draw only that part, this part over here, ectoderm, endoderm, and yes, of course, in the middle, there will be mesoderm in the middle. So imagine this one to be the mesoderm in the middle, that yellow colored one. Now what is the further development here, guys? The further development is ectoderm will invaginate inside, endoderm will evaginate outside. So of course this black colored line is ectoderm, the red colored line is nothing but your endoderm, and in the middle this part here will be the mesoderm. So what's happening right now is ectoderm will invaginate, it's moving in, whereas endoderm will invaginate out. So further diagram, let me draw it here. Let's draw the further diagram here, like what is the further development? And I'm going to use the same color code here. So imagine this one here, there will be your ectoderm invaginating here. 1, and then 2, then 3, then 4, then, and I'm using the same color code here. This one is your endoderm, which is invaginating out here. Perfect. And in the middle, that yellow colored one will be your mesoderm, guys. So let me just remove this to avoid any distraction. Perfect. Now what will be the name for these ones? Welcome. Ectoderm is going to form this invagination, and these are referred to as ectodermal cleft. Ectodermal cleft. And cleft means it has to be cleft only. Okay, you cannot use any other word there like invagination or depression or sulcus and all. Ectoderm is going to form cleft. And how many clefts do you have? Let's count them. Number 1, number 2, number 3, and finally number 4. So there are totally 4 ectodermal clefts. Then similarly, endoderm is going to form the invagination here, and these are known as the endodermal pouches. And as I said you, pouches means pouches. You cannot use any other term there. So it is endodermal pouches. Endoderm is going to form the pouches. And again the same thing, how many do you have there? There will be 4 endodermal pouches. So ectoderm is the one which is going to form cleft. Endoderm is the one which is going to form the pouches. And now welcome to the mesoderm in the middle. The mesoderm which is trapped in the middle over here, it's the one which is going to form your favorite pharyngeal arches that you have been mugging up from the first year onwards. So pharyngeal arches are the one which is formed from mesoderm arches. So there will be like arches. There are totally 6 of them initially. But what is going to happen here? Let us give the numbering to these arches here. So these are your arches here. What is going to happen here during development? During development, out of the 6 arches, the 5th arch is the one which will degenerate. It will disappear. So initially there are totally 6 arches. The 5th arch will disappear, degenerate. So therefore, in human beings, you are remaining with 1, 2, 3, 4 and 6. Look at the numbering properly there. So how many pharyngeal arches do you have there? 1, 2, 3, 4 and 6. The 5th one will actually disappear. So I want you all to first of all focus on terminology. Don't try to be in a hurry. Don't try to directly jump and learn about the derivatives. It's waste. First learn the terminology. What are cleft, what are pouches and what are arches? Ectoderm is going to form cleft, endoderm is going to form pouches, and mesoderm is the one which is going to form arches. And what I have done here is that in your textbooks and all, embryology textbooks and all, the naming is given as pharyngeal only. Like you have got pharyngeal cleft and then pharyngeal pouches and pharyngeal arches. But I have done a slight modification there so that my students can remember that very well for long term. Instead of pharyngeal, let's use the word as ectodermal so that you remember that clefts are from ectoderm only. Okay. So ectodermal cleft, endodermal pouches, and then mesodermal arches will be there, pharyngeal arches of course. Now again coming to the pharyngeal arches, how many pharyngeal arches do you have initially? Initially there will be 6 of them, the 5th one will disappear. But what is going to happen? There will be a remnant of that one. There will be the remnant of the 5th arch, and that remnant of the 5th arch is referred to as ultimobranchial body. Ultimobranchial body. And this ultimobranchial body is the point of confusion in many books. It is given different answers are given to this one. There is a lot of controversy behind that. But remember today, ultimobranchial body, what is the final answer here? Remember, it is the remnant of ultimobranchial body. It is the remnant of 5th arch. Ultimobranchial body, it is the remnant of 5th arch. Remember that very clearly, guys, here itself. Now once you are done with this one, once you have understood all this information over here, one more thing I would like to tell you here is that one more controversy that I want to actually clear here is that parafollicular cells or C cells, parafollicular C cells, in many of the books they have given that it is derived from ultimobranchial body. Absolutely wrong. It is not derived from ultimobranchial body. What is exactly happening here is parafollicular cells are actually derived from neural crest cells. Now, just for the sake of understanding, you do like this. For example, you imagine this is ultimobranchial body. Just for the sake of understanding, schematic. Ultimobranchial body. The neural crest cells will migrate and come here, and they'll sit on the ultimobranchial body, and there they are actually going to form the parafollicular cells. So basically, parafollicular cells are derived from neural crest cells, and ultimobranchial body is just acting like a platform. Understanding? So there is no confusion at all. So remember, or you just write down here itself that yes, the neural crest cells, NCC. So neural crest cells are coming all the way up to the ultimobranchial body, and they are the one which are forming the parafollicular cells, or else they are also referred to as C cells. So let us clarify, let us clear one more controversy here itself. So remember, parafollicular cells or the C cells are ultimately derived from where? The neural crest cells. That is the better answer. And roughly I am telling you, even though I don't want to say that, but roughly I am telling you, if you don't find in the options neural crest cells, then no other option left. You have to go for ultimobranchial body. But to be very specific, remember, parafollicular cells are derivatives of neural crest cells. If you don't find that in the option, then we have to go for ultimobranchial body. Clear? Now, once you are clear with all this terminology and all, now let me tell you further thing. That is nothing but the derivatives only. So now what is the only thing that is left out? We need to learn what are derived from the ectodermal cleft, what is derived from the endodermal pouches, and then what is derived from the arches. Just we need to learn the derivatives, and this topic will be done. Such a simple thing, and unnecessarily students will be like having a phobia with embryology and all. It's all about understanding properly from the scratch. Now let us see what are the derivatives, guys. Now in the derivatives, let me first teach you about the cleft and pouches, then at last we'll go to the arches. So first concentrate on cleft and pouches. Now again the same thing, let us draw the next diagram. I hope you are drawing the diagrams in sequence one by one. Now let us see the further development now. So I'm using the same color code here. The ectodermal clefts. And what is the further development here is that the second arch. Now there should be no point of confusion, guys. The moment I'm saying arch, it should automatically strike in your mind that arch is the one which will be derived from mesoderm. Perfect. So this one here will be the first arch, then the second arch, then the third arch, and the fourth arch and sixth arch. Now I'm telling you about the second arch. Now what is going to happen is that the second arch will be growing more faster, and because of this, it is going to form this evagination over here. So there is an outgrowth from the second arch, the mesodermal. I'm using the same color code. Now what is going to happen? Let us first of all see what will be the derivatives of ectodermal clefts. All the four ectodermal clefts, what is derived from there? The best way, I'm telling you, the best way which with you will never be able to forget that in your lifetime, apply this on your body. Don't simply just mug up like a table there, structure, derivatives, I hate that thing. What you do is apply that on your body. So again, same thing, you are an embryo, I am an embryo here. If this is your ectoderm over here, guys, if this is the ectoderm here, ectoderm is invaginating inside. And just look at my finger, where did I keep my finger here? There's nothing but your external auditory canal, external acoustic meatus, whatever. So external acoustic meatus, this is the one which will be derived from the first ectodermal cleft. Ectoderm is going to form the cleft here. The first cleft is going to form external acoustic meatus. So this first cleft, it is the one which is going to form external acoustic meatus, but not the entire thing that is going to form the epithelium of that one, that is external acoustic meatus, fine. And not only the external acoustic meatus, remember along with that it is also going to form outer layer of tympanic membrane. It is also going to form outer layer of tympanic membrane. So it's easy right now. The external acoustic meatus along with the outer layer of tympanic membrane is derived from the first ectodermal cleft. Now obviously the question comes in our mind, so what is derived from the second cleft, the third cleft and the fourth cleft? And the good news here is that nothing is derived from there. Why? Why? Because I told you very clearly, second arch will be growing faster, and because of that growth, what is going to happen? It's going to obliterate, close the second, third and the fourth cleft, and nothing derived from there. So just remember, second and the third and fourth cleft all these three are obliterated, nothing derived from there. And that completes the entire story of ectodermal clefts derivatives. Done. One topic has been completed. Simple. So only you have to remember about the first cleft. First cleft is going to form the external acoustic meatus along with the outer layer of tympanic membrane, and remaining second, third and the fourth are completely obliterated. And now, my dear friends, you can correlate the embryology with the gross anatomy. After this external acoustic meatus, there is no other structure over here. Our neck is completely smooth here, it is closed here. Nothing derived from here. You can clearly apply the embryology onto your gross anatomy. Now, in some unfortunate people, what is going to happen, I'll tell you. Because of this overgrowth because of the rapid growth of the second arch, there is some space created here. And this space which is formed here is known as the sinus. That is your cervical sinus here, this one. That is cervical sinus. Fine. So this space over here is referred to as your cervical sinus. Fine. Okay, fine. Now, normally what will happen in the normal human beings like you and me, that cervical sinus has to be completely closed off. But in some unfortunate people, it remains that, and that condition is actually referred to as, if it persists, if this cervical sinus persists, and that is actually known as the branchial cyst. Branchial cyst. Okay, so that is another important question that you have to remember, has been already tested in your exam. So cervical sinus is the space present over there. Normally in you and me right now, the cervical sinus has been completely closed. But in some unfortunate people, if it remains there, if it persists there, it will be forming a cyst along here. That cyst is actually referred to as branchial cyst. So what is branchial cyst? Nothing but the persistent cervical sinus. That's all. Done. That's everything regarding the ectodermal cleft. Now on the other side, let us now learn about the derivatives of endodermal pouches. And this is like much more easy. Endodermal pouches. Now why am I telling you like it is easy? Why? Because first pouch you yourself can guess. Just try to understand like this here. From outside, the first ectodermal cleft, it is the one going to form external acoustic meatus, external ear. Now at the same place from inside, what is going to join? The first pouch. So what is going to join with the external ear? The middle ear. So that is the reason why the first pouch is the one which is going to form your middle ear cavity. The first pouch is going to form middle ear cavity. And not only middle ear cavity, along with that, even the auditory tube or the eustachian tube. If you people have learned in ENT, when you learn about the structure of ear, auditory tube is the one attached to the middle ear only. So therefore, even the auditory tube or the eustachian tube is also derived from the endodermal pouch, the first endodermal pouch. And along with that, even the inner layer of tympanic membrane. Inner layer of tympanic membrane is also derived from the first pouch. Perfect. Inner layer of tympanic membrane is also derived from the first pouch. That makes sense. So first cleft from outside is going to form the external acoustic meatus. The first pouch is going to form the middle ear cavity and associated structures. Now here itself, I want to give you one beautiful conclusion here. I think you all have learned about the tympanic membrane. It's a very famous and very old question. Tympanic membrane is derived from which germ layer? Every student will be shouting in the class. It is derived from all the three germ layers. Welcome to my embryology. I'll prove you here. Outer layer is derived from first cleft, ectoderm. Inner layer will be derived from the first pouch, that is endoderm. And what do you have in the middle? Middle you have actually the mesoderm present there. So therefore, it is the one which is going to form your membrane. And which membrane here, sir? We are speaking about tympanic membrane. And therefore, tympanic membrane is derived from all the three germ layers. It is getting the contribution from ecto, endo and mesoderm. It makes sense here. Between the external ear and the middle ear, we have got the tympanic membrane. Getting contribution from all the three germ layers. You will never forget from now onwards in your lifetime. Now further, after completing this one here, now the further thing, what is derived from the second and then the third and then the fourth pouch. Best way, again the same thing, apply on your body. Just now we have completed with ectoderm, ectodermal cleft, and now on the inner side, endodermal pouches. The first pouch is one which is going to form middle ear. Similarly, little bit below, the second pouch is going to contribute, or it is the one which is going to form the palatine tonsil. The third and the fourth pouch here, they are going to contribute for the formation of parathyroid gland. So I'm telling you again and again, the best way to learn, apply on your body. Otherwise, it's a waste of mugging up. So second pouch is the one which is going to form the palatine tonsil. But here there is a catch. It is not going to form the entire palatine tonsil, only the epithelium. Only the epithelium of the palatine tonsil is formed from here. Not the entire lymphoids of the palatine tonsil. And if you want the answer for that one, the lymphoids which are present in the palatine tonsil are derived from neural crystals again. So lymphoids of the palatine tonsil, if you want to write it separately somewhere, it is derived from the neural crystals. Only the epithelium of the palatine tonsil is derived from second pouch. Now what about the third pouch? Third pouch is the one which is going to form thymus, and it is so easy to remember. Just remember like a rhyming word there. Pronunciation is the same. Third pouch is the one which is going to form thymus. Third pouch is going to form thymus. And along with the thymus, it is going to form inferior parathyroid gland. Inferior parathyroid gland. Whereas the fourth pouch is the one which is going to form superior parathyroid gland. Superior parathyroid gland. Now here again the students will be confused. Why? It's kind of opposite. The third pouch which is above here, it is the one which is going to form inferior. And the fourth pouch which is below, that is the one which is going to form superior parathyroid. What is it? It's kind of opposite. I'll tell you one simple story how to remember about this one so that you will never forget in the lifetime. A simple story here. Third pouch and the fourth pouch. Third pouch is the one which is going to form thymus. Easy to remember. Third thymus. Okay. But the problem here is that, is the thymus located here exactly? What is the exact anatomical location of thymus? In gross anatomy, is the thymus located here in the neck region, cervical region? No. The thymus has to go down into the mediastinum. So therefore what will happen? Come on, let's begin the story now. After the formation here, the thymus will actually start migrating. Now while migrating, the parathyroid gland present over there will say, thymus, I will also come along with you. So now thymus will say, okay, let's go together. So thymus and parathyroid gland, both of them will start migrating together, best friends. So they are migrating, going down, going down, going down. Okay. Now suddenly in the middle of the way, parathyroid gland realizes, oh, I am parathyroid gland. Why I am coming along with you? So therefore it says, thymus, you go ahead. I'll stay here. Okay. This is all for the sake of remembering, guys. This is how we remember the things. So now the parathyroid gland stays back there only, but thymus will further migrate down into the mediastinum. But it's too late. It has come down. So therefore, that's the one which is going to form your inferior parathyroid gland. So it's migrating along with the thymus. It is the one which is going to form inferior parathyroid gland. But whereas fourth pouch, there only it is going to form the superior parathyroid gland. So I'm actually a strong believer that studies cannot be done very seriously. Sometimes these kind of things will actually help you in remembering. So you'll never forget from today onwards, third pouch, thymus, along with inferior parathyroid gland, whereas the fourth pouch is going to form the superior parathyroid gland there itself. And by this, if you are observing properly there, I am done with the derivatives of ectodermal clefts and the endodermal pouches. I am done with the derivatives of ectodermal cleft and endodermal pouches, completed in the one simple diagram here, without any confusion, with all the things possible for you to remember for long term. Now after this, we are going to move towards the arches. Let us see the derivatives of pharyngeal arches, and that will complete this topic over here. Now after completing the derivatives of the pouches and the clefts, ectodermal cleft and endodermal pouches, we are done with all the derivatives of that, and I even told you the tricks how to remember that. Now let's get started with the pharyngeal arches. And you all know very well, arches are actually derived from where? From the mesoderm part. They are forming from the mesoderm part. And we know mesoderm is the one which is actually going to form the bones, the ligaments and muscles and everything. So all that is derived from there. And here also, guys, don't panic at all. I will tell you every trick possible for you to remember that easily. Okay. So let's get started now. Now in the pharyngeal arches, I want you all to first of all remember which nerve will be supplying to which pharyngeal arch. We know the pharyngeal arches will be like 1, 2, 3, 4 and 6th. Initially 6 pharyngeal arches will be there, but the fifth one will degenerate. So we have got like 1, 2, 3, 4 and 6. Now what is the nerve which will be supplying to all these pharyngeal arches? First learn this one, guys. The nerve supplying to the first pharyngeal arch will be the mandibular nerve, that is 5, 3, mandibular nerve. So trigeminal nerve will give rise to 3 branches, ophthalmic, maxillary, mandibular. So 5, 3, mandibular nerve. The nerve supplying to the second arch will be the facial nerve, the 7th one. The nerve supplying to the third arch will be the glossopharyngeal nerve, that is 9th one. And then the nerve which is supplying to 4th arch will be superior laryngeal nerve, and 6th arch will be recurrent laryngeal nerve. And we all know very well these two are branches of vagus only, the 10th nerve. We have learned about all the cranial nerves in detail in head and neck part, gross anatomy of head and neck. And this topic will be mostly like a revision of that one. So you need to revise all that I have taught you in the cranial nerves topic. And that becomes quite easy for us to recall the derivatives. That's the complete strategy. So if you learn the cranial nerves perfectly, then the derivatives will become damn easy. Now first thing I want to remember, like how do we remember all these nerves which is supplying to each and every pharyngeal arch? Let me give you a small trick, guys. So let me give you a small trick here. Let's have a comparison. First of all, in nervous system, I hope you all have learned about the parasympathetic nervous system. And parasympathetic nervous system, I hope you all remember parasympathetic outflow will be craniosacral outflow. Parasympathetic outflow will be craniosacral outflow. Now, how many cranial nerves do we have? We have like totally 12 pairs of cranial nerves. But are all the 12 pairs of cranial nerves contributing for parasympathetic nervous system? No. The cranial nerves which are contributing for parasympathetic nervous system will be 3, 7, 9, 10. So parasympathetic outflow is nothing but craniosacral outflow. And in that cranial nerves will be 3, 7, 9 and 10. Fine. Oculomotor, the facial, glossopharyngeal and vagus will contribute for parasympathetic nervous system. Now apart from nervous system, let's go to a little bit of biochemistry over here. In biochemistry, I think you have learned about the clotting factors. The clotting factors which are dependent on vitamin K. Vitamin K dependent clotting factors. Vitamin K dependent clotting factors are 2, 7, 9, 10. I hope you remember that. The factor number 2 prothrombin, factor number 7 stable factor, 9th one will be the Christmas factor, and then 10th one will be Stewart power factor. That is 2, 7, 9, 10. But remember, not the cranial nerve, that is clotting factors. You might be thinking, why sir going into the biochemistry? I'll tell you. Now lastly, welcome to embryology. And in embryology, the pharyngeal arches. And in pharyngeal arches, remember 5, 7, 9 and 10. Oh my god, what is this? The fifth cranial nerve, trigeminal. Which branch? Mandibular. Mandibular is the one which will be supplying to first arch. Facial nerve is the one which will be supplying to second arch. And then 9th, glossopharyngeal is supplying to third arch, whereas vagus nerve is the one supplying to 4th and 6th arch. And that is 5, 7, 9, 10. And I always advise the students to remember this 7, 9, 10 of your entire medicine. So somewhere in our medicine, we actually have 3, 7, 9, 10 parasympathetic, and then 2, 7, 9, 10 biochemistry, vitamin K dependent clotting factors, and then finally 5, 7, 9, 10 pharyngeal arches. A small trick to remember the nerve supply to pharyngeal arches. No confusion at all. Learn it along with me in the class itself, guys. In this video itself, you learn it along with me. So 5, 7, 9, 10 is the nerve supplying to pharyngeal arches. Now, if you are comfortable and perfect with the nerve supply without any mugging up, I told you a simple trick how to remember 5, 7, 9, 10. Now, once you are perfect with the nerve supply, now learning the muscles derived from here will be damn easy. Like which muscles are derived from here will become easy. What is the trick, sir? I'll tell you the trick here. Listen very carefully now. Mandibular nerve is the one supplying to first arch. Mandibular nerve is supplying to which arch? First arch. Therefore, whatever muscles are supplied by mandibular nerve, all those muscles are derived from first arch. Just at least to recall the major one. For example, we have learned in gross anatomy, head and neck gross anatomy, all the muscles of mastication, temporalis, lateral pterygoid, medial pterygoid. Muscles of mastication are supplied by mandibular nerve. If they are supplied by mandibular nerve, definitely they are derived from first arch. Similarly, who doesn't knows about this one, guys? Facial nerve is the one which will be supplying to what? It is supplying to all the muscles of facial expression. So all those muscles of facial expression has to be derived from which arch only? Second arch only. They have to be derived from which arch? Second arch. So muscles of facial expression are derived from which arch? Second arch. So in this manner, that is the reason why I told you it's like a revision of cranial nerves only. So from cranial nerves, whatever we studied in head and neck gross anatomy, recall whatever muscles are supplied, all of them are derived from that particular arch. Now let us just do the copy paste here. Okay, let's write down. So please make a table there. In the first column, let us write down about the arch number, the pharyngeal arch number. And in the second column, let us write down the nerve which is supplying to the pharyngeal arch. And in the third column, let us write down which muscles will be derived from here. So arch number 1, the nerve supply will be the mandibular nerve, that is 5-3. If it is mandibular nerve, the muscles derived will be number 1, muscles of mastication. The muscles of mastication. Awesome. Now not only muscles of mastication, recall mandibular nerve, it is also supplying to two tensors. One will be tensor veli palatini, tensor veli palatini muscle, and another one will be the tensor tympani muscle. Tensor tympani muscle. So tensor tympani, I hope you remember, it is a part, or that is a muscle present in your middle ear cavity, in the middle ear cavity. So tensor tympani in the middle ear, and tensor veli palatini, name itself is telling you it is a muscle of the palate. Not only two tensors, mandibular nerve 5-3 is also supplying to anterior belly of digastric. Anterior belly of digastric. And along with the anterior belly of digastric, you also have to remember mylohyoid muscle. So anterior belly of digastric and mylohyoid together, they are going to form that oral diaphragm. So I always remember these two muscles together and then the two tensors together. Muscles of mastication is for sure. Every student knows that. The confusion will be with that 4 different muscles. So remember two tensors, tensor veli palatini and then tensor tympani, and then remember anterior belly of digastric along with the mylohyoid. All these are derived from the arch number 1, the pharyngeal arch number 1. Perfect. Now welcome to the arch number 2, second arch. Arch number 2, what is the nerve supply? It is a facial nerve. I told you to remember 5, 7, 9, 10. 5, 7, 9, 10. So 7th nerve, facial nerve, is the one supplying to second arch. When it is facial nerve, then definitely which muscles are derived from here? The muscles of facial expression. Not only muscles of facial expression, you just write down there, including buccinator muscle, that is also supplied by facial nerve only. Platysma muscle, even that is also supplied by facial nerve only. And not only that, the auricular muscles and even the occipitalis muscle. Occipitalis muscle. So buccinator in the cheek here, required for blowing the cheeks, something like this, and the platysma muscle over here, that is required for stiffening of the neck, something like this. Okay, and then the auricular muscles which are present around the auricle, mostly vestigial, and then occipitalis muscle. So buccinator, platysma, auricular, occipitalis, all these muscles are also derived from the second arch only. How can you tell so confidently? All of them are supplied by facial nerve. Not to forget, one more is stapedius muscle, and stapedius is also present in the middle ear only, and that stapedius muscle is supplied by nerve 2 stapedius, which is a branch of facial nerve. We have learned that very clearly in the cranial nerves. And then just now in the very first arch, I have written there anterior belly of digastric along with mylohyoid. Now it is posterior belly of digastric along with stylohyoid. So posterior belly of digastric muscle, and along with that always you have to remember stylohyoid together. Everything is almost the same for these two muscles, their origin, their insertion, everything is same. So posterior belly of digastric along with stylohyoid. All these are the muscles which are derived from the arch number 2, second arch. And believe me, my dear friends, this is extremely important. The first arch and second arch is extremely important. Most of the time in the exams, the questions will be coming from these arches only. And I told you the trick, how to remember. Then after that, welcome to the arch number 3. Arch number 3, it will be supplied by ninth nerve, glossopharyngeal nerve. Glossopharyngeal nerve. I told you the mnemonic, how to remember, 5, 7, 9, 10. And when it is glossopharyngeal nerve, the only and only one muscle that is derived from here will be stylopharyngeus muscle. Stylopharyngeus muscle. And I hope you all remember from head and neck topic, I told you to remember stylopharyngeus muscle को style मारना होता है, and for style you require glossopharyngeal nerve. So glossopharyngeal nerve is supplying to only one muscle, stylopharyngeus, derived from third arch. Fourth arch will be supplied by superior laryngeal nerve. Then come on, recall, it's like a revision, recall. Which muscles will be supplied by superior laryngeal nerve? Number 1 muscle, cricothyroid. I will even recall you people from where did we study about this one. Cricothyroid is the only muscle of the larynx present outside externally, supplied by external laryngeal nerve, which is a branch of superior laryngeal only. So cricothyroid. And not only cricothyroid muscle, what else muscles will be derived from here? You have to include even the muscles of pharynx as well as palate. How come? You remember VAC, vagoaccessory complex? We have learned about that vagoaccessory complex, and superior laryngeal nerve is the one which is actually involved in the formation of that. So therefore, from here, which all muscles are derived? Yes, even all the muscles of pharynx are also derived from here, except which muscles? Except one is stylopharyngeus, and another one, number 2, will be the cricopharyngeus. So one is stylopharyngeus muscle and another one will be the crico. Exceptions are important here, guys. So all the muscles of pharynx are derived from fourth arch only. They are derived from fourth arch only except the stylo and crico. And why it is so? Why? Because you can clearly see here, stylopharyngeus muscle is the one which will be supplied by glossopharyngeal nerve. And that is why it is derived from third arch. I'll tell you, it will be supplied by recurrent laryngeal nerve. Not only that, even all the muscles of palate are also derived from here only, except tensor veli palatini, TVP, tensor veli palatini muscle. Why? Let me use a same color code here. Why it is like tensor veli palatini is exception here? Why? Because we have already seen tensors are the one which are derived from the first arch. So tensors, tensor veli palatini, tensors are actually derived from the first arch. Okay. So it's crystal clear now. Now once you are done with the fourth arch, the last and final one which is remaining is sixth arch, and sixth arch is supplied by a recurrent laryngeal nerve, and recurrent laryngeal nerve is the one which will be supplying to all the muscles of larynx, except the only one muscle of the larynx present outside, that is cricothyroid muscle. So all the muscles of larynx are supplied by recurrent laryngeal nerve except the only one present outside, cricothyroid. And that cricothyroid, let me again use a same color code here. That is the one which we have written here. It is supplied by external laryngeal branch of superior laryngeal nerve. I hope you are not getting confused. All the students who have actually listened to my cranial nerves topic, they'll be enjoying this one. If you are listening this directly, then there'll be confusion. So better, this can be learned perfectly only in the cranial nerves. Now again, we can't draw all those diagrams here to make you understand. So in cranial nerves, we have done that everything in detail. Afterwards, this is like a cakewalk here. Not only this one, we can even include one more muscle over here, that is cricopharyngeus muscle. Cricopharyngeus muscle, which I have written over here. So cricopharyngeus muscle is also supplied by recurrent laryngeal nerve. So these are all the muscles which are derived from the third arch and even the fourth arch and the sixth arch. The third arch, fourth arch and the sixth arch, these are all the muscles derived. Now if you recall what I tell you in the beginning of this one, pharyngeal arches are actually formed from the mesoderm, And when it is about the mesoderm means all, like bones and the ligaments and muscles, everything is derived from there. But what we have written here in the table, only the muscles. So therefore, my dear friends, now let us recall and learn about the bones and ligaments derived from here. Let's see which bones and which ligaments are actually derived from all these pharyngeal arches. And it is so easy to remember. Let me show you one diagram here, and that diagram is going to make the things easy for you in your exam. So let me show you one diagram here, guys. Now look at this beautiful diagram on the screen here, sir. Now in this diagram, it will actually help you answer a lot of questions in your exam, and it is a very simple diagram. How come? Like I told you in the very beginning of the pharyngeal arches topic, that like all the arches are one by one. They are arranged like, all the arches are arranged like one by one. Now in all those arches, all the structures are going to form like layer by layer, one by one. So you can see everything that is marked here in orange color is actually derived from the first arch. Everything marked in the blue color is derived from the second arch. Then in the yellow color there, that is actually derived from your third arch, and so on, so on. So simultaneously what we'll do is we'll make the table here, and then simultaneously we'll cross check with the diagram also, guys. Now first of all, again the same thing, make a table here, arch number, pharyngeal arch number 1. Now let us see what are the bones and ligaments which are derived from arch number 1. I'll tell you the trick, try to remember in the same manner, my dear friends. Arch number 1, it is the one which is going to form the bones in your ear, the ear ossicles, I mean to say, malleus, incus and the stapes. But out of that, remember S for stapes and S for second arch. S for stapes and remember S for second arch. That means what is the only thing remaining? That is malleus and incus. So write down there, the first arch is the one which is going to form the malleus and even the incus. Malleus and incus is derived from the first arch. And then not only this, there will be ligament here, sir. Anterior ligament of malleus. Anterior ligament of the malleus. And one more thing will be the sphenomandibular ligament. Sphenomandibular ligament also. And once you are done with the sphenomandibular ligament, that is almost coming to the mandible there. Yes, remember the mandible. And once you have learned about the mandible here, the mandible that itself is actually going to give rise to the maxillary process, and then the temporal, the zygomatic, all those are indirectly derived from the first arch only. So arch number 1 is the one which is going to form your malleus and incus, then anterior ligament of the malleus, and then the sphenomandibular ligament, and then the mandible, and indirectly like remaining everything is derived from there only. Now sir, how do you remember all this? I told you, right? This picture should come in your mind while answering the questions. Now in this picture, you're able to observe here malleus and then incus. Then the ligament is not shown here, guys, the anterior ligament of the malleus, just for the sake of remembering. And then from the spine of the sphenoid bone, there will be sphenomandibular ligament. I hope you remember, on the medial side of the mandible, there will be a tongue-like structure known as lingula, and that will come and get attached to the lingula part. So from the spine of the sphenoid to the lingula, sphenomandibular ligament. Then of course the mandible, and if it is mandible here, then remaining everything is like quite easy. Hope you're able to understand here. I repeat again, malleus and incus, anterior ligament of the malleus, sphenomandibular ligament, the mandible, and the remaining indirect derivatives of that. Next one. Now once you are done with the derivatives from the first arch, now welcome to the arch number 2, second arch. And second arch is the one which is going to form stapes. Stapes. I told you the trick already, S for stapes and remember S for second arch. Stapes. Now my dear friends, remember it is going to form the entire stapes except what? Except the foot plate, and not only the foot plate, the ligament around that, that is annular ligament. These two are not derived from the arch number 2. I'll tell you a little bit in more depth also. There is actually a cartilage model here which is known as the Richard's cartilage or Rickard's cartilage, whatever you love to say. So Richard's cartilage is the one which is going to form your entire stapes except the foot plate and the annular ligament. And remember these two, the foot plate of the stapes and the annular ligament, these two are derived from otic capsule. Let me tell you here itself, that is derived from otic capsule. Now once you are done with the stapes, and all that exception and everything is clear, do one thing, follow my trick here, draw a small diagram here guys. Styloid process, and then the hyoid bone. Hyoid bone will have a greater horn, lesser horn. Then there will be body of the hyoid bone, lesser horn and the greater horn. From the styloid process, there will be a ligament attached to the lesser horn of the hyoid bone. Just keep writing here. What is the name of this process? This is styloid process. And this ligament here will be the stylohyoid ligament. Stylohyoid ligament. And then in the hyoid bone, my dear doctors, remember only the lesser horn and the upper part of the body. I repeat again, only the lesser horn and upper part of body of hyoid bone. Understanding? So in this manner, if you just remember this simple diagram here, that small diagram, everything else will come in your mind. And so instead of just writing like paragraph and mugging up, better draw in small diagram. Styloid process here, and the stylohyoid ligament over here, and only the lesser horn and upper part of the body. All this will be derived from your second arch. That's all derived from your second arch. And if you're observing there carefully, almost everything in the second arch will be like with S. S for stapes, S for styloid process, S for stylohyoid ligament, and even the lesser horn and the upper part of the body of the hyoid bone. Almost everything is with S only. So that is about the second arch. Now, apart from this, what I want to add up here, see, after the third arch and fourth arch are like quite easy guys, so don't worry a lot about them. It's all about the first and second arch. So let us discuss everything in detail here. Apart from that, what I want you to remember is the first arch. What is the another name of that one? What is another name of the first arch there guys? It is also known as the mandibular arch. Okay. And the second arch, remember the another name of that, it is also known as hyoid arch. So the first arch will be the mandibular arch, and the second arch will be actually the hyoid arch, another name of that. Fine. Now what I am trying to tell you here is that these two arches, they will actually have a cartilage model. The first arch will be having a cartilage that has been given a specific name as Meckel's cartilage, and the second arch, that is hyoid arch, will have the cartilage model that is known as the Ricker's cartilage. And whatever structures that we have written here, all of them will be actually derived from those particular cartilages only. I'll tell you here. For example, what will be the derivatives of Meckel's cartilage? Everything here. So no confusion at all. All this will be derived from the Meckel's cartilage only, which is the cartilage model of first arch. Malleus, incus, the anterior ligament of malleus, the sphenomandibular, everything will be derived from the Meckel's cartilage only. Okay. And then what is the derivative from the Ricker's cartilage? Ricker's cartilage, yes, the derivative will be your stapes. And you already know the exception over there. So what is the exception guys? The stapes will be formed except the foot plate of the stapes and the annular ligament, which is derived from the otic capsule. You don't have to create some confusion over here. What is this? All these different names guys. Make it simple. The first arch, it is also known as the mandibular arch. The first arch is also known as the mandibular arch, and the cartilage model will be Meckel's cartilage. And the second arch will be the hyoid arch, and the cartilage model will be Ricker's cartilage. And we have to learn the derivatives. Done. Now, once you are done with this one, I hope you are able to recall, we are almost up to hyoid bone. What about the lower part of the hyoid bone then? Greater horn and even the lower part of the body of the hyoid bone. Definitely, as I told you, it's like layer by layer by layer. So it should be derived from your third arch. So third arch is the one which is going to form the greater horn and the lower part of the body of hyoid bone. Lower part of body of hyoid bone. So third arch is the one which is going to form the greater horn and lower part of the body of the hyoid bone. Then what do you have after the hyoid bone? Come on, look at this diagram here. Once you are done with the hyoid bone, then what do you have after that? After that, it's all about the larynx, and in the larynx, it's all about the cartilages of larynx only. So therefore, arch number 4, it is going to form like all the cartilages of larynx. All the cartilages of larynx. See, actually the thing is that 4th and 6th arch together they are going to form all the cartilages of larynx. There is a lot of controversy here. There is no clarity, or there is no the final answer over there which cartilages exactly are derived from which arch. So almost roughly we'll be always saying that 4th and 6th arch are together going to form all the cartilages of larynx. We'll be saying it at once. But my dear friends, remember, for the sake of remembering, if you want to remember something, all the cartilages of larynx are derived from 4th arch only, except cricoid cartilage and the base of arytenoid, which is on the cricoid cartilage. So there will be cricoid cartilage and the base of arytenoid, which is sitting on the cricoid cartilage. These two are exceptions. They are not derived from the 4th arch, if you want to remember. Then of course they are derived from where only? They are derived from the 6th arch. So cricoid and base of arytenoid are derived from 6th arch. Perfect. Mostly there is no clarity in that one, guys. Roughly we'll be saying that, all the cartilages of larynx are derived from 4th and 6th arch only. We'll be saying that. But still, if you want to remember something, then you can remember cricoid and base of arytenoid are derived from the 6th arch only. So in this manner, all the bones and ligaments which are derived from here, the best way to remember this diagram. So whenever you are solving the MCQs based on these pharyngeal arches and their derivatives, this diagram should come in your mind. Arches. This diagram should actually come in your mind. This diagram will help you a lot in remembering about the arches and their derivatives, guys. And apart from that, muscles, already I made it easy for you. All the muscles we can remember easily with the help of that nerve supply. And what is the nerve supply into the pharyngeal arches? 5, 7, 9, 10. Remember that golden rule, guys. Hope this topic has become easy. Thank you.